Hi, my name is Annabel and my partner's name is Jenna, and this is our Fall of 2020 Nutrition Project. Today we will be talking about gallstones. Before we begin the presentation, I just wanted to let you know to keep an eye out for the vocabulary words listed on the screen. They will be highlighted in yellow throughout the presentation and relate closely to the information that we have covered throughout the semester. In 1420, there was a Florentine pathologist named Antonio Benevieni who was conducting an autopsy on a woman who had passed away with severe abdominal pain. Upon inspection, Antonio discovered the presence of gallstones in the woman's biliary tract. While it is unknown if Antonio coined the commonly used term of gallstone, the medical terminology of cholelithiasis is derived from Greek origins. Gallstones or choleliths are solid masses formed from bile precipitates. The stones may occur in the gallbladder or the biliary tract. There are two types of gallstones. The first type of gallstone is the cholesterol gallstone. These are often yellow-green colored stones made of hardened excess cholesterol and are predominantly found in women and obese individuals. Cholesterol gallstones account for 80% of all gallstones. The second kind of gallstones are pigment gallstones. Pigment gallstones are black or brown stones that are made up of excess bilirubin and other materials found in bile. Black gallstones are also more likely to remain in the gallbladder and are often located in bile ducts. This can lead to obstruction and infection. Gallstones can be as small as a grain of rice or as big as a golf ball. They can also be hard or soft, or they can be smooth or jagged. All in all, gallstones vary in size, color, and appearance. Gallstones affect many parts of the body in many ways. They largely affect the gallbladder, liver, and common hepatic duct, which make up the biliary system. They also can affect the gastrointestinal system, specifically the small intestine. Gallstones form when bile hardens into pieces of solid materials. This solidification is caused by imbalances in the chemical makeup of bile. Common symptoms and related issues when one has gallstones include episodic and severe epigastric pain, pyrosis, flatulence, aerophagia, sweating, jaundice, clay-colored stools, and issues with the digestion of fats. The reason fats become difficult to digest when gallstones are present is because bile is secreted from the gallbladder through the common bile duct into the small intestine to act as an emulsifying agent when digesting fats. If gallstones prevent the passage of adequate amounts of bile, fats will pass through the GI tract and will not be digested properly. Many different risk factors of gallstones affect a variety of different populations. For example, ethnicity has an effect on one's propensity for developing gallstones. North American Indians have shown to have the highest reported rates of gallstones, while African Americans show a low propensity for developing gallstones. Additionally, the risk of gallstones increases with age. Individuals over 40 are 4 to 10 times more likely to develop gallstones. Gallstones are very rare before the age of 20, and if they are found this early, it is usually in patients with chronic predispositions such as cystic fibrosis. Gender also has an effect on the formation of gallstones. Women are almost twice as likely as men to form gallstones. This is presumably due to the effect estrogen and progesterone have on the biliary system. These hormones have been shown to affect the amounts of cholesterol present in the gallbladder and how well it contracts on a routine basis. Family history and genetics also plays a role in gallstone development. Relatives of gallstone patients are more likely to form gallstones. However, as of now, no genes have been directly linked to gallstone formation. Specific drugs such as oral contraceptives can result in the formation of gallstones. Obesity is also a significant risk factor for gallstone disease, especially in women. Studies have demonstrated that overweight women with a BMI of 30 or higher have double the risk of gallstone disease when compared to those with a BMI of less than 25. Increased physical activity appears to reduce the risk of gallstone disease in obese patients. Overweight individuals who undergo weight loss rapidly also have an increased risk of gallstone disease. On low-calorie diets, cholesterol levels increase when adipose tissue is broken down. This cholesterol is secreted into bile and leads to cholesterol supersaturation, ultimately causing stasis. There are many ways that gallstones can be diagnosed. However, diagnoses almost always begin with a physical examination from a healthcare provider. During this exam, patients will describe their symptoms and medical history and may have their abdomen palpated for tenderness. Next, blood tests can check for amylase and lipase levels as well as white blood cell counts to detect any abnormalities of the biliary tract. Ultrasounds, CTs, and MRIs can all detect the presence of gallstones and determine whether or not surgical intervention is needed. Cholecystoscintigraphy is used to detect inflammation of the gallbladder. This is done by injecting radioactive material through an IV. Imaging is used to track the radioactive material through the biliary tract. The two most useful tests are the ECRP and HIDA-scan. ECRP is an endoscopic procedure which a side view camera is fed through the upper GI tract to confirm the presence of stones. This technique is especially useful because during the same procedure, the scope can be used to remove or dislodge stones, resolving any issues. HIDA differs from CT or MRI scan in that radioactive material is injected into the patient. The flow of this radioactive material is recorded by an X-ray machine in a video format. This video shows how the material is taken into the gallbladder and released. The scan can reveal whether or not the gallbladder fully empties each time it excretes bile.
I'm Annabelle's partner, Jenna. I will be discussing treatments, risks, and costs, along with dietary restrictions and preventative strategies. Treatments include medical therapy. This involves oral dissolution therapy, which is a method that results in the secretion of unsaturated bile and ultimately stone dissolution. Surgical therapy, known as a cholecystectomy, is the only definitive treatment for symptomatic gallstones, removing fragments or the entirety of the gallbladder. Extracorporeal shock wave lithotripsy is a non-surgical alternative using high-energy sound waves that produce shock waves to generate compression and tension. If the force of these waves is strong enough, gallstones are fractured and more easily passed. Percutaneous therapies can puncture the gallbladder, dilate the biliary tract, and remove stones all in one procedure. Advantages include immediate removal of uncrushed gallstones and little production of gallstone debris. Endoscopic gallbladder stenting includes the insertion of a stent from the gallbladder to the duodenum to relieve biliary symptoms and complications in high-risk patients. Like any medical treatment, there are risks associated with treating gallstones. Among these risks are acute cholecystitis, choledocholithiasis, cholangitis, cholecystenteric fistula, Maritzi syndrome, and porcelain gallbladder. If you were to be admitted to the ER for gallstones today, it would most likely be an expensive visit. While most health insurances cover the cost of treatment, patients with insurance are still responsible for a copay of $100 or more and coinsurance of 10 to 15% of the cost of the procedure performed. On average, for patients without health insurance, a typical cholecystectomy will cost you anywhere from $10,000 to $20,000, depending on the hospital, doctor, and your overall condition. While there are no specific dietary restrictions for one who has gallstones, there are dietary recommendations. These recommendations include eating fiber-rich foods, eating fewer refined carbohydrates and less added sugars, eating more healthy fats, and avoiding unhealthy fats. By eating healthy fats, one can help the gallbladder contract and completely empty on the regular, routine basis. While many people are predisposed to gallstones, there are ways to help prevent them. You can do this by adjusting your eating plan to include the dietary recommendations previously stated and maintaining healthy weight, or, if you are overweight, losing weight safely through a healthful diet and regular physical activity.